everyone. My name is Kristina. I'm a registered nurse, and today I'm going to go over some questions from TrueLearn's NCLEX-RN Smart Bank. In one of my previous nursing jobs, I was a labor and delivery nurse, and I did work in the postpartum unit as well. So I thought these questions were fitting because it is from the maternal and child subject section. I'm happy to go through the questions with you, go through the answers and explanations. So let's get started. The nurse is performing an assessment of a newborn born at term via vaginal delivery. Which assessment finding would the nurse expect? Select all that apply. All right, so I know select all that apply is also tricky. So let's go through every question and see if it's true or false. The presence of milia. Milia are the tiny white little bumps on a newborn's face typically, and it will go away within a few weeks. So that is a newborn finding. APGAR scores of 7 and 9. This is a quick assessment that nurses do within 1 minute and 5 minutes of baby being born. And the normal is anywhere from 7 to 10. So 7 to 9, that is a normal finding. So I marked that. Weight, 7 pounds. That is normal as well. Of course, it's a range, and 7 pounds falls within that range. Heart rate, 140 beats per minute. Normal heart rate for a newborn is 120 to 160, so 140 is normal there. And blood pressure, 64/48. That is also normal. I don't really remember the range of that, but I always think of 60/40 as normal, so I went ahead and selected that. Show explanation. All right. All the answers were selected, and that is possible for select all that apply questions, which is the case here. So the bottom line, nurses must be able to perform a swift newborn assessment to recognize normal and abnormal findings. Yes, that is true. It is, especially if you want to work particularly, in the postpartum unit, it is good to know what is normal so that you can go through that quickly. And TrueLearn has this great chart here. It has characteristics and expected normal findings. It has even respirations there. It wasn't even in the question, but it's good to know the values there, and then normal reflexes and spontaneous responses. So great explanation and chart there, as well as APGAR scoring chart. Perfect to even put on a flashcard to review the signs and the scoring there. The Picmonic memory videos there with APGARs and the newborn assessment. And then references there. All right. I hope you guys find this helpful. I'm going to go through one more question as well. All right. So the nurse is caring for a client in the 3rd trimester of pregnancy who has come to the emergency department reporting spontaneous significant bleeding. Place the actions in sequence of performance by the nurse. All right, so this is a drag and drop ordering question. I'm going to read the answers and then prioritize them at the end. So monitor contractions, assess fetal heart rate, obtain maternal vital signs, place pads under the client to absorb bloody drainage, and collect blood for hematocrit and hemoglobin and type and cross. All right, so I am going to highlight that the client is in the 3rd trimester of pregnancy, and then she is reporting spontaneous significant bleeding. All right, so that's already alarming me as a nurse. Spontaneous significant bleeding, she could have placenta previa. So what are we going to do first? So we are going to prioritize her vital signs, and then we're also going to assess fetal heart rate. I'm putting maternal vital signs first because she is the one carrying the baby. Fetal heart rate is obviously very, very closely second. So I'll assess her vital signs and then get the fetal heart rate monitors and put them on her belly, and that will be that. I would perform diagnostics next, so collect blood for hematocrit, for H&H and type and cross, and then monitor contractions and place pads under the client to absorb bloody drainage. with this question, and these type of answers, monitor should always go last because we're just monitoring for contractions, especially since the question doesn't state that she has any contractions at the moment. I'm going to put that last and put comfort measures to make the patient comfortable above that. So I will submit my answer, and then, all right, that we answered correctly. The bottom line states in case of spontaneous significant bleeding in the third trimester, the mother and fetus are assessed as a priority. Laboratory or diagnostic testing is expedited, followed by comfort care and monitoring. And then there is the rich answer explanation there. It's very detailed. You can go ahead and read that, pause and read that on your own if you'd like. And then the references are there. All right. Well, I hope you find this helpful. Follow TrueLearn for more. Thanks, guys.